Hi guys, welcome back to my channel. My name is Ziad, Crohn's disease patient, NHS worker and educator, here bringing you IBD facts and taboo breaking chats. Don't forget to like, comment, share and subscribe to my channel. So let's get started. Hello and welcome to this lesson on the symptoms of IBD. So in this lesson we're going to have an in-depth look at what the different types of symptoms there can be in inflammatory bowel disease. Now the symptoms of all types of IBD are similar. The only difference is that in microscopic colitis, there may be no bleeding as the inflammation is microscopic. Even though people with IBD will experience the same type of symptoms, the severity, frequency, and order in which those symptoms will appear will be different. That is because it is dependent on where the inflammation occurs within the intestines. So, first and most obvious symptom is abdominal pain. So having abdominal pain is actually a non-specific symptom, as anything can cause stomach pain and not just IBD. However, abdominal pain is one of the most common symptoms experienced in those with IBD due to the inflammation that occurs as it causes sensitization of the nerves within the bowel. Abdominal pain can also occur due to some of the complications of IBD, such as bowel strictures, obstructions, abscesses, and fistulas, which we'll look in more detail later on in this course. Some can continue to experience abdominal pain even when in remission, as it is thought that some of the chronic inflammation that occurs causes changes to how pain is processed by the nervous system, to the point where pain is not just simply caused by the sensory pathways of the body, but involves those stimulated by emotions and other environmental stimuli. Next, we're going to look at change in bowel habits. Now, this can vary from experiencing diarrhea or constipation, but if you notice that your regular or normal bowel habits have changed, and you are either going to the toilet more often or are struggling to have a bowel motion, then this could be a sign of not only inflammatory bowel disease, but of something else. So it's always important to check with your doctor if you have a change in bowel habit. Now, the first and most obvious change in bowel habit is blood in your stools. So bleeding after a bowel motion should not be ignored, as it could be a sign of IBD or something more serious and requires the immediate attention from medical professionals. Sometimes blood is not always present or even noticeable if you have IBD, as it depends where the bleeding occurs in your intestine. Bleeding that occurs higher up in the intestine can be the same colour or darker than stool, as it has had time to congeal, whereas bleeding in the lower portion hasn't had time to congeal, which is why it can be seen more obvious with its bright red colour. You may also find that bleeding is accompanied with either pus or mucus after a bowel motion. So there are a couple of digestive complaints that can occur with inflammatory bowel disease. So bloating is one of the most common issues experienced in people with IBD and IBS, and can be defined as a sensation of gassiness or a sense of distension, sometimes accompanied with a visible increase in the size of your abdomen. The severity of bloating and discomfort felt is determined by the amount of gas that has accumulated within the intestines. Constipation can be defined as the inability to pass stool or empty the bowel on a regular basis, and is often accompanied by the need to strain when having a bowel motion due to the stool becoming hard and dry. Diarrhea can be defined as having 3 or more loose or watery bowel motions in a day, and can be classified as either acute, chronic, infectious, or non-infectious, and can occur because of the impairment in the ability of the large intestine to absorb water. And then there's fecal incontinence, which is defined as involuntary loss of either liquid or solid stool, and is often an overlooked symptom in people with IBD. I will go in much more detail about all these different digestive complaints and how you can manage them in the Taking Back Control module. Other symptoms associated with digestive complaints, especially with diarrhea and fecal incontinence, is tenesmus and urgency. Tenesmus is the feeling of needing to go to the toilet even though you have just been and your bowels are empty. It is mainly experienced in those with ulcerative colitis due to the inflammation of the rectum, but can also be experienced in those who have perianal Crohn's disease. And urgency is the sudden urge to use the toilet and to have a bowel movement, which is frequently associated with diarrhea. Next, we're going to look at appetite and weight loss. The impact of nausea, vomiting, abdominal pain, and diarrhea can cause a loss of appetite in those with IBD, either from not feeling like eating or trying to manage their bowel movements from not eating, which results in the reduced intake of food, which ultimately can lead to weight loss. Some people can also start to develop food avoidance behaviors as they associate food with pain, causing them not to eat, as well as losing interest or desire to eat, which can contribute to weight loss. This can lead to the development of disordered eating. This is where an individual develops an unhealthy relationship with food and engages in abnormal eating patterns or behaviors such as avoiding a type of food or food group and sticking to certain times they are allowed to eat, or regularly going on different types of diets to try and manage their symptoms. Due to intestinal inflammation seen in IBD, the intestines become damaged or develop scar tissue, which can reduce its ability to absorb nutrients from food, leading to malnutrition, and in children can lead to delayed growth. Those with IBD can develop disordered eating and are more likely to develop avoidant restrictive food intake disorder. This is categorized as disordered eating and not as an eating disorder because perceptions about body image and body shape are not involved, but rather it involves the avoidance or restriction of certain foods due to the association of a negative experience such as being in pain. Food aversions are common and are often learned behaviors which can arise due to several reasons, but it's mainly due to the association of that food, the smell of the food, the texture of it, and taste being unpleasant, which can remain in that person's memory. When these aversions occur in those with IBD, it can cause a subconscious labeling of foods and food groups into safe or unsafe foods, or better known as trigger foods, due to the feelings they initiate in that person. This leads to maladaptive attitudes towards foods and can instigate anxiety when it comes to meal times, social events that involve food, or even trying new foods. Next, we're going to look at the impact of fatigue as a symptom. So fatigue will look and feel different to everyone. Fatigue can be described as an extreme sense of tiredness that is overwhelming, which results in not only a lack of energy, but a lack of physical, mental, and emotional energy, leading to complete exhaustion. Even though tiredness is used to help describe fatigue, it is not the same as fatigue, and fatigue cannot go away after a good night's sleep. There is another condition called chronic fatigue syndrome, which is an extremely complicated condition that can present as severe fatigue, mental dysfunction, insomnia, dysautonia, and malaise. This makes it very difficult for individuals to carry out the simplest of their daily activities, and feelings of fatigue can last up to 6 months in this condition. Now, fatigue, as mentioned, is not just physical, it is mental as well. The worst thing aside from feeling physically drained is feeling mentally and emotionally drained due to the impact this has on mental health and motivation to do things. And mainly the symptoms of fatigue can include constantly feeling tired, getting headaches, feeling weak, having trouble concentrating, which is also known as brain fog, having a lack of motivation, being irritable, as well as the physical, emotional, and mental exhaustion that occurs. Next, we're going to look at anemia. One of the most common problems that is associated with IBD is anemia, which is a term used to describe the decreased amount of red blood cells a person has. The impaired absorption of iron and the loss of blood from bleeding can limit the amount of iron that is available for the creation of new red blood cells, which can easily lead to someone with IBD suffering from anemia. Men can be considered as being anemic if they display hemoglobin levels of less than 140 grams per litre, whereas a level of less than 120 grams per litre is used for females. There are also different types of anemia. There's iron deficiency anemia, which is low levels of iron and can cause symptoms such as breathlessness, fatigue, feeling faint, lack of energy, and the loss of appetite. And then there's vitamin B12 deficiency anemia, which is low levels of vitamin B12, which is needed to help in the formation of new red blood cells. Now, the main reasons as to why iron and vitamin B12 deficiency is common in people with IBD is either due to or a combination of inflammation of the intestines,
impairing the ability to absorb iron and other essential nutrients, causing there to be low levels. Not getting enough iron and other nutrients from the diet due to avoiding certain foods. This, in combination with intestinal inflammation, can contribute to iron, vitamin B12, and other nutritional deficiencies. The blood loss associated with IBD also causes iron stores in the body to become depleted to compensate for what is being lost. Also, a removal of a portion of the terminal ileum due to IBD surgery can reduce the available area for vitamin B12 to be absorbed, leading to vitamin B12 deficiency. And this is also the same for having inflammation within the terminal ileum, which can reduce the ability of the body to absorb vitamin B12. So to summarize, we've looked at what the different types of symptoms are in IBD, how those symptoms can occur, and what the impact of those symptoms are.